we start the year with this topic and this discussion that has been heating up. We thought it was cooling down at the end of the year when we were coming to the end of 2020, but it seems like it refused to go away. I saw someone posting saying that moment you realize that after 2020, the next one is 2021, 2022. So we still have 9 episodes of 2020 to go through. We are joined today by Dr. Rasalanavho, who is a medical doctor based in Limpopo, South Africa, and she's going to be helping us to understand these different issues and the different things that are happening regarding COVID-19. Where are we coming from? Where are we? What's going on? You know, the things that are happening surrounding us. We thought this is the topic for the time. There's so many theories out there. There's so much information, correct and wrong information. We don't know what to believe anymore. And we believed and we thought the best thing to do is to get our own that can share the information, those ones that we know that they've got our best interests at heart. Doc, welcome to Baobab Chats.
Thank you so much for having me. I'm very excited to be here today.
Firstly, can you just briefly, we have heard this over and over again, but let's start there. What exactly is COVID-19? Before we go into too much detail, just a brief recap of that.
Okay, so COVID-19 is a disease. It is a disease that is caused by a virus that we know as SARS-CoV-2, which means severe acute respiratory syndrome, CoV-2, meaning from the genome COVID disease. So this virus is part of the non-segmental family strains of RNA viruses. What it does is that it causes the disease that we commonly know as COVID-19. 19 meaning that it was found in the year 2019, as we all know, in Wuhan, China. So what this virus does is that it affects mainly your respiratory systems. What it does is that when it gets into the human host, it binds to what we know as the ACE2, ACE meaning the angiotensin converting enzyme 2. So in a layman's term, is that it will get into your body and cause a lot of symptoms, ranging from respiratory symptoms, your fever, coughing, also GI symptoms. GI mean gastrointestinal symptoms, because there are also some receptors, also ACE2 receptors in the GI lining. So even diarrhea, patients may come experiencing diarrhea, things like that. So as we know, it is a global pandemic that we've been facing since early 2020, to be exact, late 2019, as it was discovered in Wuhan. And we are still facing this global pandemic.
Whilst we are still there, just what then is the difference between the normal flu and COVID-19?
Okay, so in terms of the normal flu and the COVID-19, maybe to highlight the similarities is that they both mainly affect the respiratory symptoms, the respiratory tract. So patients will come in presenting with respiratory symptoms like your cold and fever and non-specific symptoms. However, they are very different, as we have experienced. With COVID-19, it is patients present with more severe to moderate symptoms as opposed to mild symptoms wherein there's only a cough. So with COVID-19, we've seen that it is moderate to severe, wherein the cough will not only be there but also affect your breathing. That's wherein you have difficulty in breathing. That's wherein your saturation meaning the level of oxygen in your blood starts to deteriorate. So it's a more severe form than a normal cold flu that we usually experience from season to season. And then another difference would be that we usually expect cold flus to be seasonal, but with COVID-19, as we initially thought it was going to be seasonal, but as we have seen that the pandemic is is throughout. It's even there now in South Africa. We are currently in summer, but we are witnessing a resurgence in COVID-19, although we are in summer. So that's one of the major differences that we are seeing with COVID-19 as opposed to our normal flu. So normal flu, minor symptoms, easy to treat. However, with COVID-19, it's a wide range of symptoms that can be moderate to severe, life-threatening, and also it's non-seasonal as we had hoped.
And that begins our, our process of talking about the different information that is out there. Where at the beginning, we had, people having a perspective that no, COVID-19 does not survive in the sun. When it's hot, when it comes to summer, there was a lot of speculation about no. When summer starts, this will end and this will disappear. And like exactly what you said, we have seen that is not the case. And we've seen pictures that were being shown of the 1918 flu, of people at hospitals being shown pictures whilst they were outside. And we were made to believe, or a lot of us believe that no, it was because they were being put outside so that they're exposed to the sun, because the sun. And we thought that is actually the reason why this would not be a very big problem. But like you say, do you have something maybe just to add on to that, in terms of these speculations that people have spoken about?
Yes, I think the general idea initially was that it is a seasonal virus. But as I've highlighted before, we are actually seeing the resurgence now in summer. A season where we were expecting it to be, cool, where we're expecting the infections to go down. But that's the opposite. That's the opposite. We actually are seeing more infections now. And then, so generally, I wouldn't say that it is a seasonal thing as we initially thought, because definitely there is a resurgence and peak, a lot of new infections now, even in summer.
Whilst we are there now, let's talk about this second wave, the resurgence, as you term it. What has been the main difference between the two? And why we, just to shape this question is that because the people who feel I didn't get it in the first wave, so I'm not going to get it. Then there's people that say I got it in the first wave, so I'm not going to get the one in the second wave. And there are people who think they got it in the first wave, whether it was just a flu or not. That's a different discussion. So what's between the difference between that first wave and second wave?
So the difference would be the numbers and the virulence of the first wave and the second wave. We are definitely seeing more patients coming in with this second wave. And with the first wave, patients would come in with just mild respiratory symptoms. And according to the studies that were done at that time, they were saying that patients, about 80% of the patient would come in with very mild respiratory symptoms that wouldn't even warrant admission, that would warrant self-quarantine or self-isolation at home. But now with the second wave, patients are now presenting with moderate to severe symptoms. We are seeing a lot of patients that are coming in that are very sick, a lot of patients coming in that requires admission to hospital for oxygen therapy, a lot of patients that are not actually doing well with minimal oxygen therapy that needs intubation and to be taken in high facility care, like in ICU. And then a lot of deaths now with the second wave compared to the initial wave. And with the second wave, we're seeing that it is more, it is affecting more of our people, and it's affecting them in a more severe way than the initial wave. And then with regards to if you can get it again, if you got it with the first wave and can get it again with the second wave. So there are patients who have been presenting with COVID-19 that were initially tested in the first wave, they had COVID, and then the respiratory, because the reinfection scientifically is defined as a patient who had COVID-19, was symptomatic, and was tested positive with a PCR test. PCR test is the one that we do with the swabs, and then it was confirmed that the patient had COVID-19. And then at a period of about a month without symptoms, and generally the patient was well. And then after a month or more, the patient comes again with symptoms and then tests again positive for COVID-19. That would be a scientific definition of reinfection. So we are actually, yes, seeing patients who are being reinfected, patients who were tested positive initially for COVID in the first wave, then were fine, they isolated, then there were symptoms for about a month or two, and then are coming again and with symptoms of COVID-19. Yes, you can still, there is still a chance of reinfection with COVID-19.
And this chance of reinfection, is it related to the issue of the new strain or the mutant? There's different, others are calling it the UK mutant or whatever, or it's just linked to just COVID. It can be the initial strain, or it can be the new strain.
Okay. So as we know, there's a new strain that is a new variant that was identified in the UK and also South Africa. But with the reinfection, it can be either way. Some scientists say that the reinfection could be because of the patient's own immunity. So you would get immunity from the first infection, but it weans off quickly as opposed to other people. So there's this rapid weaning off of the immunity that you previously got. That is patient dependent. And also in some cases is that you'd find that the patient did have COVID-19, but there was sort of like a suppression of the virus as opposed to total eradication of the virus. So with the reinfection, there's that reemergence of the virus, or there's that expression of the virus that was initially not that was initially sort of like suppressed. So it can be either way. It can be virus-related factor, the virus itself. It can be patient-related factor, the patients in themselves with regards to the immunity. It can be a lot of things. So yes, you can still be affected by the same strain of virus that you initially had, mainly based on the factors that I've alluded to initially.
All right. All right, great. And then, so Doc, now let's talk about the vaccinations. Of course, the vaccines, I think they haven't yet reached South Africa yet, and most parts of Africa, but there is talk of vaccines, arriving, and some that have started arriving. And this is where this discussion becomes even more scary. You are a health professional, and as a frontline worker, when the vaccines start, I've had in most countries, they start with the people, the frontline workers, and those that are identified as vulnerable groups. Before we specifically talk about the COVID-19 vaccine, can we just talk about vaccines? What exactly is a vaccine? Why does one take a vaccine? What does a vaccine do? And can we give examples of vaccines that we have also already been taking, or that have been taken, and how they've panned out and affected lives?
So with the vaccine, just to put it simply, what we target, or what a vaccine does, is that we want the body to get used to fighting a virus before you are infected with the real virus, or with the real pathogen, bacteria, whatever. It can be a vaccine of a virus, of a bacteria, whatever. So what usually happens with the vaccine is that you get injected with sort of like an inactive or a killed form, or a weakened form of the pathogen that will not necessarily cause illness in your body. So when that happens, when you get injected with that inactive form of the virus, your body will then start will then trigger an immune response. With that immune response, you get immunity to that disease or to that infection. So what will then happen is that when you then get exposed to the real pathogen or to the real offender, to the real disease, your body is now used to fighting that infection. Your body already has guns that are equipped to fight that infection. So in a way, your body already knows how to deal with that infection because you've been exposed to the sort of like an inactive or a fake form of the virus. So when you get exposed to it, then it means that it won't be as severe, or your body will be able to cope well with that infection. That is the general idea behind vaccines. There's a lot of vaccines that we get, most of them just from childbirth. There's BCG, which is for TB. There's actually a program for immunization for children. There's also a vaccine for a common cold that is received annually. So that is the general idea behind the vaccine. However, with the COVID-19 vaccine, it's a bit different. You're not getting the inactivated or the weakened form of the virus. It is a messenger RNA vaccine. So what it does, you do not get the virus. What it does is that you get they inject you, then your body will be able to produce what we call a protein. A protein that will sort of like help in initiating events that will help with your immunity. So that is the difference between the normal vaccines that we know and the COVID vaccine. So with COVID vaccine, they're not giving you the virus itself. They're giving you substances that will make your body produce immunity, which is like a
And there, Doc, that's where we really need to talk. When you start saying RNA and the difference between the COVID-19 vaccines and vaccines that we use for other diseases, because this is where people say this RNA, it will change your DNA, it will affect you in this way, and people are saying, we're not going to take this vaccine, we don't want to see it. Can you maybe highlight a little bit more on those concerns in terms of should people feel safe to take it based on that? And I know it's a very technical term, this RNA. Even myself, I don't understand it. You just said it now, but it's to escape me. If you can break it down a little bit more.
So with the vaccine, it won't alter your RNA or your DNA because it is not incorporated to your DNA system. So what it does is that it triggers your body to produce a certain protein. It is not going to alter your DNA. It is not going to be incorporated in your DNA or whatever the case. So it doesn't even go to the DNA systems of the body. What it does is that it triggers your body to produce proteins. Those proteins will then initiate an immune response. So in terms of it affecting the RNAs and the DNAs, it doesn't work like that.
Okay, and thank you for clarifying that, because this is the area where we find many people having concerns and being worried about this vaccine. All right, so as we wrap up, Doc, then the next question also then becomes, when these vaccines arrive or they come, there is the Chinese ones and there's the UK, and there's all different companies. I don't want to mention specific names because then I might, but there is issues about, no, maybe trust the one from here and don't trust the one from there. The one from there has got 50% chances. That one has got 80% chances. That one has 90% chances. Should these kinds of information concern us, or this is something that we shouldn't be concerned about? All we should be concerned about is that once a vaccine arrives and they say it's being given at hospitals, we should trust our health professionals like yourself that spent so many years studying, medicine. We trust you to say, when you're giving us a vaccine, this is right for us, and we should just come and queue up for them.
Yes, so a lot of clinical trials are actually conducted before any form of vaccine is given to anybody. So I once had a speech from an African president saying that I'm not sure if it was a president or prime minister. They were saying that they would never administer a vaccine if it is not proven to be safe. This proving should be proven by people, scientists from Africa, scientists that we trust, scientists that we know. So these vaccines, they pass through tests that actually prove that it is safe for to be administered in people. So in that regard, even our scientists must have proved that it is safe for us to actually use before it is given to our population.
Thank you so much, Doc, and thank you for everyone for following. And we hope that we have another time to share again, regarding this crucial topic. Feel free to share your comments. Feel free to share with others, to share information, and feel free to give us some questions. We can try to get Doc back again on Baobab Chat so that we can discuss this in more detail, or maybe answer specific questions that you might have. But from me and the team, thank you and bye-bye for now.